All right, good afternoon, ladies and gentlemen. I'm Chuck Ramey. I'm the Chief of Public Affairs here at the VA Southern Nevada Healthcare System. I do want to welcome you for coming out to virtually to our town hall today here in Southern Nevada and joining the Veterans Health Administration, Veterans Benefits Administration, and the Nevada Department of Veterans Services for today's quarterly Veterans Town Hall. So we greatly appreciate you being here. Just a little housekeeping before we get started. So this is a moderated town hall. I've put a note in the chat box there. So what we'll be doing is following our updates by our various leaders, we will do a moderated session, which we will take Q&A that has been submitted to us in advance via email.
The phone right now.
That's of a general nature.
But I'm in school from 1 o'clock to...
All right. There we go. And that'll be our next housekeeping item is muting your phone lines. So we'll take questions of a general nature and we'll talk about those here today and answer what we can. But the questions that are of a personal nature, we do not want to get into those with patient privacy and HIPAA type violations. So we'll take those offline and we'll have the appropriate agency get back with you afterwards. So before we get started, I do want to thank, Mr. Karen talk about our leadership that's here today, and he'll start in a minute. But I do want to thank our members of our congressional delegation for being here today. We have Brendan Vargas from the office of Senator Jackie Rosen. We have Alana and Kenneth from the office of Catherine Cortez Masto. We have Samantha from the office of Congressman Stephen Horsford, and we have Andrew from the office of Congresswoman Susie Lee. And I believe Daniel was going to try to join us as well from the office of Congressman Dina Titus. So I do want to thank all of them for being here today, as well as our congressional partners. So I tell you what we'll do is I'm going to see if Mr. Karen is online and ready. I'm going to turn it over to him for some opening remarks, and he'll be followed by Director Fritz from the department, or from the Veterans Benefits Administration's Reno Regional Office, and then we will have Mr. Fred Wagger, who is the Deputy Director of Operations for the Nevada Department of Veterans Services, speak, and then Dr. Ramu Kamandori, who's our Chief of Staff, and then we'll move into our moderated session. So Director Karen, sir, the floor is yours.
Thank you, Chuck. Just a quick sound check. How's the audio?
You are Lima Charlie 5x5.
Outstanding. Oh, what a wonderful Wednesday. We've been through a lot over this past year, as many have been experiencing side by side with us. My apologies to the congressional staffers. They're going to hear some of the same information that I shared with them this morning. But hearing it twice is not a bad thing sometimes. We have come a long ways this past year. I've really seen the best come out in people here at the healthcare system, working so hard to take care of our staff and, of course, our veterans. Our current focus now is managing the COVID inpatient population, which has wound down quite a bit. We were at a high of 38 COVID positive veterans inpatients in the hospital at our peaks. Ranging now from anywhere as we've been as low as 1 or 2, and today we've got a half a dozen in-house this morning, and another handful. We range between 5 and 10 in the community at any given time. So it's come down quite a bit. That's given us some opportunity to accelerate access into the procedural areas, special procedures unit, the OR, those types of areas, which has been outstanding. So we're progressing along with our moving forward plan. We're starting to shift now to, we've done so much VA Video Connect and a lot of virtual care, which was a blessing in today's day and age to be able to continue to provide healthcare even during some of the lockdown periods when COVID was at its peak. But now we're opening up to more face-to-face care. We're adjusting the grids, particularly in primary care and specialty care. So you'll be seeing more opportunities out at the clinics. Shift away from VA Video Connect, still highly utilized, but doing more face-to-face care. Vaccinate, vaccinate, vaccinate. We have been vaccinating 7 days a week. We've really gained some wonderful momentum, and not just here locally in Las Vegas and within our healthcare system, but across the country, which is wonderful news for everyone. I believe we crossed, we're over 32,000 injections that have been given. We've put out predominantly the Pfizer vaccine. We did have some allocation of Moderna, which we've utilized. We've got some Johnson & Johnson that we've been using as well. So a shout out to our staff managing all 3 lanes of vaccination. Our internal capacity, our ability to treat veterans in a growing healthcare system that we're in now, we've had consistent growth since this place was opened and saw its first inpatient back in 2012. We were flat during the pandemic for obvious reasons with the slowdowns in care, but I expect that trajectory to shoot right back up. So we've been heavily reliant on community care for those reasons of growth. We're continuing to build our internal capacity. We'll still have to leverage the community. Obviously, we can't be all things to all veterans all the time, but very important that we're continuing to round out our healthcare system and the offerings that we have for veterans. The 4th mission that you hear so much about, we work closely with Nellis during the pandemic, hand in hand with the community during the pandemic, and even currently we have 10 staff members assisting with FEMA down at the Cashman Center providing vaccinations as well. We've had some people deployed under our emergency preparedness, our DEMS program. A lot of fine work has been done here. Couldn't be more proud of that. Some of the tactical goals that we're working on this year are particularly related to access and the veteran experience with access. In a city such as Las Vegas, where there's challenges getting in for healthcare because we are still pretty low in terms of number of physicians and nurses per capita, it's really always a challenge for access. So we're building that internally and leveraging the community, as I mentioned. But that experience on access is not just the actual appointment getting, it's getting through that scheduling system, getting through on the phones, having that care coordinated, whether it's the inpatient alignment, coordinating that care through inpatient time or on the outpatient side. We really want to make sure those touch points are a positive experience for our veterans. So a lot of work being built around that currently and going through this year. I think primary care and specialty care are probably our biggest lifts. We're finally balancing out on the staffing side where we can accommodate, particularly with VA Video Connect, we've got very, very good access. But as I mentioned, we want to get a little more face-to-face care blended in there now that more and more people are vaccinated. Our inpatient throughput, I mentioned, working hard on that. You might have heard some feedback on the new beneficiary travel system that was rolled out. That has had far more bumps than we anticipated. We were the first to kind of ring the bell to our network regionally and then to VA central office talking about the backlog and the challenges with that new program. Unfortunately, they've heard us. They're working hard on licenses. We're adding more staff to that program, working that backlog down. That has been a challenge. It's one of those things that investment up front is painful on the front end, but it should pay some nice dividends on the back end, and it should be more seamless for veterans. But that has resulted in a poor experience thus far. So we're working hard on that. The American Rescue Plan, the stimulus package, a big part of that went to COVID-19 related healthcare in VA. Actually, there's about $14.5 billion targeted just for COVID-19 related healthcare, and there's also $1 billion in there for debt forgiveness related to co-payments. So that we'll be working on that and how we're going to unwind that piece here over the next several weeks and months. Also $100 million in there for supply chain enhancements, which I think is a great asset for us. We're following DoD's lead on that with supply chain. Fortunately, we did not suffer from many disruptions in terms of providing personal protective gear and that for our staff. We never ran low on that type of equipment during the pandemic. Our vaccine numbers, I mentioned, quite a few vaccinations being put out. We'll continue that march. That is a primary focus for us, at least over the next several months. And I did want to mention, as I wrap up my remarks, we have a few new leadership positions that have turned over. We've hired a new deputy director who hails from Chillicothe, Ohio. He was the associate director out there. His name is Mr. Jim Ziegler. He is our deputy director, just started a couple weeks ago, so we welcome him, Air Force veteran as well. Has been with VA now for several years, so we're happy to have him. We also have Ms. Chandra Lake, who is the associate director, typically the associate director out in Hawaii. She is doing a detail out here with us for 120 days. And our prior acting associate director, Mr. John Stelsa, which many of you know is out in Hawaii, did a bit of an exchange so that they could gain some varied experiences in their respective medical centers. I wanted to mention that. And Mr. Tim Jobin, who's our chief of behavioral health, typically is now in our acting assistant director role. So we're lucky to have them all working hard towards enhancing our veterans' care and experience. So those are my comments up front, and I will turn it back over to Mr. Ramey.
All right. Thanks, Director Karen, for that great update. As we've been moving forward with our healthcare options, our veterans benefits partners have been doing the same. And we have a great partnership here with Director Franco Fritz and his team. So Director Fritz is going to come on the line and give you the benefits side of the updates, what's going on in VA. So Director Fritz, sir, the floor is yours.
All right. Can you hear me?
Yes, sir.
Okay, great. Okay, good afternoon, everybody. So I'll start off with a couple of local, the local services that we provide. Our public contact unit down here within the hospital is now open by appointments, but we are seeing other veterans that walk in for other appointments and things as we have time. And there's a lot. I know we have a lot of people that have been waiting for us to open, and so. I think last week we did 77 appointments, but at the same time we had over 200 walk-ins that just needed a status or wanted to drop something off. So we're going to continue that. We're operating at full capacity. So anybody who needs to come in and make an appointment, that would be great. So I'm glad to finally get back to this point. Our information about our operating status and updates are on our website, which is benefits.va.gov/Reno. So, you can check on it there. And if one of my people will put that in the chat, I think. One thing that's good for the whole state is, as far as VBA, is we are opening a call center in Reno. So this is good for the whole state of Nevada. It's a national call center. We'll be the only call center for VBA that's totally in the Pacific District time zone. It'll be about an 80 person addition to our staff. As far as claims processing, we've been able to continue processing claims over the past year at a record pace. We were prepared to send claims processors home. We've been working on that for several years, and that's what we did last March, is send everyone home. The result has been great. We have had some impacts by the pandemic, of course. We've seen compensation and pension examinations slowed down just because the examiners, there were no face-to-face exams during that whole time. So that kind of slowed the process a little, but it's starting to back up right now. And
I'm going to mute myself.
Dr. Fritz, I think you were accidentally muted.
Okay, is that better?
Yes, sir. Sorry about that. Somebody was talking. I think I accidentally muted you instead of them. My apologies, sir.
Hey, that's okay. Like I said, the comp and pen exams, those got slowed down, but it's picking back up now. So we should see that start moving pretty quick. The other thing was our Federal Records Center closed down and during the pandemic and working on a skeleton crew, but they're opening back up now, and thanks to the Veterans Health Administration for vaccinating all those folks so that they could get back to work, and so we should start seeing those federal records coming out quicker too. But like I said, it hasn't slowed us down too much. We've been able to do claims at a faster rate than we did last year even. So that's all good. Some of the things, on a national level that due to COVID-19 that we've done in VBA are We are continuing to the suspension of collection on all our veteran benefits overpayments and medical co-payments, just like Director Karen said, all the way through 9/30 of this year. And I think if it keeps going, it doesn't look like it's going to. I think we're seeing some positive things in with the pandemic, but we usually keep extending it. We have an existing moratorium with our VA loans on the evictions and foreclosures, and as well as VA loan forbearance requests, and that's been extended to 6/30. Could be extended again. So if you have that problem, or anybody out there that you know, that's a possibility. They can go to va.gov and find all the information there. We've temporarily extended application deadlines for our veterans insurance for an additional 90 days so that we offer more flexibility to separating service members, and that's through June also. And just like I said, our federal record setting are open again in phase 1. And we were doing anyway, while they were closed, we were accepting DD-214s that weren't, that were just copies because we couldn't get the originals from the Federal Record Center. So that was one thing that helped us that not to be such a slowdown. I'm sure that many of you have heard about the 3 new conditions that added to the Agent Orange presumptive conditions. So those 3 issues were added in January. So those are bladder cancer, hypothyroidism, and Parkinson-like syndrome. So we haven't started processing those. We have 63,000 of those right now. And we're just encouraging veterans and survivors to submit claims while efforts are underway to develop final procedures for our appropriate processing. This can take, it's usually a big lift, and that's why we usually delay it, because we've got to figure out what is the universe of these claims, how many are there, and how many veterans are affected, and then what strategy we're going to use, take a regional office somewhere, a large regional office offline, and get them prepared to do those types of claims. So you should be hearing about that pretty soon, but anybody who's had Agent Orange, was exposed to Agent Orange, Blue Water Navy, or on land, and have bladder cancer, hypothyroidism, or Parkinson-like syndrome, please submit your claims now, and we will get them done. Blue Water Navy claims, that started last year. I think I gave a presentation about a year ago on that on one of these town halls. So since that time, we've for Nevada, just for Nevada veterans, we've completed almost 700 claims, and we've awarded $10.7 million in back pay. And, that's compared to nationally, we've done 48,000 claims, and we've awarded $830 million back pay. So that's great news for all those veterans that have been waiting for so long. Another thing I want to just mention on here is that for anybody who was using e-benefits, and maybe a lot of you already know this, but e-benefits started out in the beginning how we submitted claims online. That whole platform has been going away since 2017 and migrating over to va.gov. So that migration will be complete by the end of April. The majority of all VBA features that were in e-benefits have now moved to va.gov, and the final few features are transitioning. So, go to va.gov. There's a lot of good info there, and everything you ever did before in e-benefits is also there. I do want to mention the Veterans Banking Program is another thing we started this year during the pandemic. We have more than 50,000 veterans right now that have switched to receiving their their benefits through direct deposit. A lot of times before we were sending it out in paper checks, and that can sometimes lead to some fraud and different things like that. So we kind of worked with the Association of Military Banks of America and Defense Credit Union Counseling to get veterans a cheap, inexpensive, safe, and secure bank account, in order to get their benefits. So if you don't have an account with a financial institution, you should check out va.gov and look that up if you want to have a cheap way to get your benefits straight into a direct deposit program. I don't have much information on the next subject. It's too long to go into, but a lot of you that are service connected for musculoskeletal and muscle injuries, our VA rating, our schedule for rating disabilities is changing. It's that part of our schedule has changed in February to reflect updated medical info. So, some of the names of the, we got rid of all the outdated names of different kinds of musculoskeletal conditions and things like that. But this revision ensures we use current medical terminology and we remove obsolete conditions and things like that. And we'll be using different diagnostic codes. But pending on, even though it was passed it was changed in February of this year, anybody who submits a claim now are going to be considered under both the old and the new rating criteria, and whichever criteria is more favorable to the veteran, that's the one we'll apply. And then after, going forward, we'll only use the new criteria. Let's see, I have another thing about insurance here. We've reduced our premiums effective April 1st so that the veterans insurance, so that is a cost-effective option for veterans and transitioning military. And like I said, it was extended also. So, it's a good low cost insurance. It's going to be reduced by 7% across all age groups. And the last thing is just that, and I think I already mentioned, is our National Archives, NARA, and our National Personal Record Center. They are reopening, and so any of you or VSOs or anyone else out there that have been waiting on records can now get those records, and that process should speed up. So that's really all I have for today. And I'll turn it back over to Chuck.
Great. Thanks, Director Fritz. I appreciate that. And then your team in the box did type in the claims assistance phone number as well as the email address. And they also put a link in there for assistance with VA debt. So there's a website in there as well. So that is in the chat box for anybody who is looking for that information. And before I kind of move on, there is a question that kind of gets to that last part you were talking about with the Veterans Group life insurance. Figured might as well answer it now. Is we had a veteran type in here. Will the VA ever offer open enrollment for VGLI? Do we know anything about that, Director Fritz?
I don't know about that, but I can find out.
Okay.
About that. It's not a question that has come up before.
Excellent. Well, thank you, sir. I appreciate that. I just saw it right there. I thought we just answered. It was an easy one since you were just talking about that. So, okay, great. Thank you, sir. All right, I'm going to see if Deputy Director Wagger has joined us from Nevada Department of Veteran Services. Sir, are you on the line? Alrighty, I did not see him. I know today is like a Military and Veterans Day at the Nevada Legislature, which Nevada Department of Veterans Services does in partnership with the Assembly. So he could have gotten tied up with some of that. But if he comes online here at some point, we'll give him an opportunity to provide us an update. All right, let me see if our Chief of Staff, Dr. Comanduri, is online. Sir, are you online?
Hey Chuck, I'm here, yeah, in the directors conference room.
Okay.
All right, good afternoon, everybody. Thanks so much for joining us. And first, as Mr. Karen talked about, we need to vaccinate. That has become obviously a critical mission. This is our way out of the pandemic. I don't know if the data has been shared yet, but as of today, we have over 32% of veterans vaccinated, at least from our VA here. And we know some veterans are getting the vaccines in the community. I know several that have gotten it out in the community. So the number is probably higher than 30%, 32%. So that's great news. We have 91% of our employees are vaccinated. So that's another great news. So when you come to the VA, you could certainly feel safe that the employees are vaccinated, and certainly already at least 1 in 3 veterans, and certainly more than 1 in 3 are likely to be vaccinated. So very positive thing. We've used all of the major platforms. That is, the Pfizer is the major one that we've used at the medical center, which is the one that requires super cold storage. We've also utilized Moderna. That was only for a short period of time, but increasingly we'll have more access to Pfizer, and hopefully in the future maybe get some more Moderna. We also have used the Johnson & Johnson, and that's the vaccine that's a one-shot opportunity that you don't have to do a second dose for it. Johnson & Johnson, we've been able to utilize, especially for folks that have a history of anaphylactic reactions to other vaccines. It's a vaccine that's been recommended. So we've had some employees and veterans get the Johnson & Johnson's because they have other reactions. And because the amount we have has been relatively small for when we get Johnson & Johnson, we end up having to reserve it folks that probably have other reasons why they couldn't take regular vaccines. So good news is the vaccine front is going well. The next thing, as Bill talked about, the moving forward, our veterans have asked for face-to-face care, and we're working to bring on more face-to-face care. So we had moved to having a lot of staff doing VA Video Connect from home or doing VA Video Connect from the clinic. We're now looking at bringing on more face-to-face opportunities for care. So we'll work on improving our access to face-to-face care. That's a good thing. And we have been fortunate enough to recruit more primary care folks, so that's moving well. Continue to hire more mental health providers, and that's actually gone well too. So that's good news. The area we struggle with recruitment has been specialists, but the good news is just today we reviewed some candidates for cardiology. We're looking at in other departments too, where we can bring subspecialty doctors in so we can keep more of our healthcare in the VA system. The third thing I want to say is, and it's an important point, why come to the VA? Why choose VA as the message goes? Why choose VA? Well, if you look at the data on preventive measures, and so a lot of folks outside the VA, we've seen the data where it shows people didn't getting their colorectal cancer screening done. Many women didn't get mammography done, right? So all of these preventive measures are not occurring in the community. The good news is the VA, we have been really focused on still doing preventive care despite the fact of dealing with the global pandemic. So we have done a much better job than the most of the community. If you look at all the data, our facility in particular has done well. So that's another great news why to choose to come to the VA and use the VA. So I'll stop there and see if there's any questions.
All right, great, Dr. Comanderi. We're going to hold questions. If you do have them, just email them, or if they're of a general nature, you can type them in the chat box, just nothing personal in the chat box there, and we'll grab them when we get to our session. I'm going to see, I think Deputy Director Wagger was going to try and join us. So I'm going to see if he was able to make it on.
I am here.
All right, sir. Well, thank you. We know you're busy today, so thanks for taking the time to join us. So I'll turn the floor over to you, sir.
I apologize for being late. I was actually on the phone with somebody from the agency earlier and said, I had 2 meetings here. I don't remember which one I'm supposed to attend. And so I got on the other one and forgot all about this. So my apologies. Happy St. Patrick's Day. I am wearing green for all the Irish folks in the audience, and so grateful to be here. I do want to let folks know, of course, today is what we call VAMDAL Day. It's the Veterans and Military Day at the legislature. And this morning at 11:30, well, actually 11 o'clock, the Senate started their floor session with a prayer from the National Guard chaplain, and then later at the end of their program, they did our video tribute. The video was created by Nevada Department of Veteran Services, the Nevada National Guard, and the Veterans Legislative Council, the United Veterans Legislative Council. So they did that, and then the Assembly did it as well. And so we appreciate the legislature and all the support we get from them. If you want to watch those, I believe those are on our website now, and you can see the videos that we. What's that? Oh. I am very happy to report for our homes. We have no residents and no staff at either one of our homes with COVID-19 right now. So we're very, very happy about that. We used all kinds of preventative methods to make sure our folks were safe, and certainly appreciate all the staff at both homes for everything they've done to keep our residents safe. We are still taking claims telephonically and virtually, and that's been going very well. Just last month, we had over 1,100 incoming phone calls, and we respond to those within 24 hours. So that keeps our folks very busy. We have 11 and a half VSOs right now. We cut one person in half, but that person's actually part-time. So we appreciate everything they're doing as well. The number to call if you need some help is 702-830-2000. I'll repeat that again a little bit, but that is statewide, but it's a local number here in Las Vegas. So we've gotten over 1,100 calls just this last month, and we're very pleased with the outpouring of comments from the veterans saying they get quick treatment. We really appreciate that. Our Ask a VSO button on the website has been very busy. We had over 120 clicks on that. In fact, we had one from Abu Dhabi, and we've had them in the past from Kuwait and even Australia, where folks are in the military, but they're getting out, coming back to Nevada and need some assistance. We also get a ton of Ask a VSOs from other states. So it just shows how popular it is. And then most of the calls or the clicks are from Nevada veterans. Again, the number you can call is 702-830-2000. We're not involved with any in-person outreach yet at this point. We're not sure when we're going to start that. We also haven't opened our offices for in-person visits yet. When we do, those will be by appointment only to begin with. We are having good success with telephonic and virtual, so we don't feel the necessity to expose our folks as yet, but we're putting all the measures in place. Here at the Las Vegas VA Medical Center, we've actually installed all the plexiglass. All of that's ready to go for when we do that. So please know that we're thinking about our veterans, and if you need anything, please give us a buzz. We had a Women Veterans virtual conference on March 3rd. Featured speaker was Shoshana Johnson, former POW, first African-American female POW in the country. And so she was captured at the same time as Jessica Lynch. We all heard about Jessica back in the day. So the first 100 Nevada women veterans who registered and attended that conference received a free book that we provided with her signature from Shoshana and with her autograph. And so we appreciate her doing that for us. And as always, I always wrap up with Veteran of the Month, Veteran Supporter of the Month. We did have a number of Veteran of the Month nominees for the next meeting. Veteran Service Commission meets on April 15th. And so they will be making the decision on who the selectees are for that to receive Veteran of the Month and Veteran Support of the Month from the governor. We only had 4 nominees. We had 3 slots, but we had 4 nominees for Veteran Support of the Month, so we can always use more. So if your organization is doing great things for veterans, it doesn't have to be an individual. Veteran Support of the Month can also be an organization. But if you have someone who's not a veteran, but they're going above and beyond for veterans in Nevada, nominate them, recognize them for their hard work, and let them know they're appreciated. Unless there's any questions, Chuck, that completes my update, and I'll stand by.
All right, great. Thanks, Deputy Director Wagner. I appreciate that, especially with your busy schedule today. And I know I normally schedule about 3 or 4 meetings at the same time, so no worries. So thank you for taking the time to join us. So I just want to move into, we're going to move into our Q&A session here. Before we do, I do want to kind of give you an update. I know that Dr. Comanduri and Director Karen have both talked about vaccines. So we are currently, just want to kind of tell you kind of the current policy, what we're doing with that, because we do have a few questions about that. We are doing vaccines for all enrolled veterans in VA healthcare here in Southern Nevada. You have to be enrolled in healthcare at this time, and of any age, you can get your vaccine, and you can do that through one of 2 methods. One is by appointment. You can either call our appointment line, which for vaccines, which is 702-791-9185. And we have people on there that are making appointments for the vaccine. The thing with that, though, is that they're not specialists. They're not there to talk about your personal health care situation or whether you should or should not get the vaccine. They're there strictly to, if you qualify for VA healthcare here locally and want to get the vaccine, they will schedule you either with one of your clinics, if there's an appointment availability at a clinic, or here at the medical center. So that is one way. The other way is via walk-in basis. We are doing that here at the medical center, typically Monday through Friday from 7:30 to 4. That is downstairs in our auditorium here at the VA Medical Center, and you can walk in, any enrolled veteran. If you're in our system and you're enrolled, you can get your vaccine then. They will schedule you for your second vaccine during that time to come back and get it. We're also doing occasional weekend sessions here at the medical center for walk-ins, and we are making some appointments when people contact us as well. So, but those are announced pretty much weekly when we do those. I believe our next one will be coming up this Saturday, if I'm correct. Is that correct? I know John Archket's on the line. Let me see if he's got that. John, is that correct? Okay. So I believe it's Saturday. The other thing too is that a lot of our enrolled veterans are getting a vet text right now. It's a text message kind of allowing them to enroll in a vaccine. They can reply back to that. If you've gotten your vaccine in the community, we ask you to reply back to that too and let us know you've been vaccinated. So that is another a way of getting your vaccine is and setting an appointment is through the vet text as well. As far as people have been asking about spouses or been asking about caregivers, the only people we are allowed outside of veterans right now, and this is because it's public law, is we can only do enrolled veterans. Veterans are enrolled in healthcare because that's how we're getting our allotment of vaccine right now. And we can only do anybody who is a primary or secondary caregiver that's part of the comprehensive program of support for caregivers. That's a formal program that the VA has, and you have to be approved and part of that program for the VA currently to give out your vaccination. Now, there's a couple bills on the Hill right now, one in the House that just passed and one in the Senate that's a kind of a partner bill to grant VA permission to give any veteran the vaccine, whether or not he or she is enrolled in healthcare. And one of those versions, I believe it's a Senate version, is also tacking on the ability to provide spouses with vaccines as well. None of that has been passed or signed by the president, and we don't have a vaccination allotment that's been given to us to take on that amount of workload or the resources for that right at the moment. But as that moves through and we hear more information, we will share that with you. But unfortunately, right now, only enrolled veterans and primary and secondary caregivers as part of that comprehensive program for caregivers are the only people we're able to vaccinate right now, and that's because of public law. So just wanted to pass that along to you. It's not that we don't want to, it's just that we cannot. All right. So we'll move on to our Q&A session right now, and we'll try and answer these ones that are of public comment the best we can right now. But if we can't, we will take them and we will get you an answer back afterwards. So let's see here. I think I answered this first one.
In the chat box?
Okay. No, they're not in the chat box. I've got a list of questions that were submitted to me, so I'm looking at them on the screen here. So first question is when we pay for prescriptions out of pocket, how do we get money back for that? I think we're going to have to take that question. That's a very good question. We're going to have to talk to our community care and our pharmacy about that just to find out the process. So we do have the person that submitted that, so we'll get that answer back to you for prescription reimbursement and how that works and what the options are to get your prescription filled. And, particularly there's two different ways. One is with your getting care in a community through a community provider and part of a approved community care, or through the VA. So we'll get you an answer on that one. The next one, I'm seeing if VBA can answer this one. It said, can a college dependent collect both VA benefits and DEA Chapter 35 benefits? So I'm assuming if that's GI Bill and Chapter 35, which is a VBA program. Is there somebody from VBA that can answer that or has a quick answer?
Right. Chuck, I don't know. I don't have an answer to that, but I mean, the education program is separate from us, but it is under our umbrella. But if Jerome is on, or Val, do you have the answer to that? I have some subject matter experts on the line.
Good afternoon. Good afternoon.
All right. Good.
I apologize. Good afternoon, Director Fix, Director Karen. This is Jerome. To answer that question, the entitlement is going to be either or. So you're either going to accept the GI Bill or you're going to accept the DIC benefit, and that's coming from Muskogee Education. So it's going to be either or, whichever is the greater benefit.
All right, excellent. Thanks, Jerome. And I know that the VBA has a lot of information on their website about that. I had a friend who kind of asked a very similar question recently, and was able to point them out to that area. So thank you. Appreciate that. Next question is, I think it's more of an observation than a question, and we will take your concern forward. The veteran states that they find it frustrating contacting an enrollment office. They had moved from Colorado, and they had talked to many via phone. They're just trying to contact somebody in our enrollment office to make sure there's no surprises and that their records are moved. Please advise. So we have your contact information. We'll do that. As Mr. Karen said, we are trying to work to our returning to our moving forward and returning to normal. So we are working to try and bring those business operations back up online as quickly as we can, so that we can either do by appointment or a face-to-face basis. I do know with our enrollment office that you can come out here to the VA. We do have a phone number on our website, but you can come out to the VA. We do have a check-in counter there. There is a kiosk that's open from 7 to 4 Monday through Friday, and you can check in there, or you can call them. The number is 702-791-9071. So there's a couple options, but we will take that back, that our veterans are having frustrations trying to talk with the enrollment office. So thank you for that comment. Next comment is, I will say that the service at the VA hospital is excellent. I got service in Colorado as well. However, the attitude of VA workers, and I'm assuming they say here, puts them over the top, or puts us over the top. So thank you for that comment. Let's see here. The next one is kind of what Mr. Karen talked about. It's I'm having issues with past travel claims from May of last year. Is there someone I can contact directly? I believe we have your contact information. We'll share that with our travel office. As Mr. Karen explained, we got forced into this new BTSS system. They did not provide us the proper resources to manage it, so we're getting more licenses, more manning down there to get our backlog caught up with that system. But there is a delay, but we will forward that one on to see if we can get you some assistance with that.
Hey, Chuck, this is Jim. I'll just add to that a little bit of clarity for professionals to understand the magnitude of the situation. We have a backlog that Mr. Karen had mentioned, that our facility was the one that really raised the flag and rang the bell, letting the nation know that there was a challenge with BTSS. And what we are doing is on the 20th and the 27th of March, we'll be holding stand downs where we'll be processing those claims in bulk. I don't know exactly how many we're going to be able to get through because the licenses are a challenge, but we definitely are aware of it, and we are doing our best diligence to get there. And I'm sure that Chuck and his team will get you connected with the appropriate people to find out the status of your individual claims.
Yes, thanks, Mr. Ziegler. And that is Mr. Jim Ziegler, our new deputy director. So we are happy to have you here, sir. So thank you. And then Mr. Archket did check back in with me, and he has said that we do have 2 more weekend vaccine clinics coming up. One is Saturday, March 20th, and the next one is the 27th of March. He said there'll be appointments and walk-in for both of those clinics, and veterans who receive their first dose at one of these clinics will be scheduled for the second dose about 21 days later. So that's the information on that one. I will go through some of our other questions here. Let's see here. We talked about travel. Let's see here. We talked about spouses and the vaccine. I'm going through the ones that are in the chat box now. This next question is one I'll let Dr. Comanduri address this one. It says, are we ever going to get any doctors in Pahrump, Nevada? All our healthcare has been video conferencing. And I think, it's kind of, we have a great doctor who does provide some great telecare down there, Dr. Sarna, but I'll let Dr. Comanduri kind of talk about Pahrump.
All right, great. Thank you so much. Yeah, it's been not just Pahrump. I think all the rural communities, we've struggled across the nation to get folks to work in rural communities. Now, one thing, I actually sit on the governor's task force for promoting and adding graduate medical education across the state. So this is not just for veterans, but everybody in the community. So one of the things that we've done as a task force, which I hopefully will bear fruit, is we actually put money aside to fund a rural residency program for family medicine. One of the things we did is funded one up in Elko. So that we have these young doctors training in a rural community so that when they're done with training, they will now know the community. They know how to be able to adjust and live and be comfortable in this community so that they are able to function in that setting. So once these training programs, they're now in their second year or third year of their training program. So they're finishing their training. So they're graduating their initial folks. So our goal, and this is going to be a sustaining program. So our goal, the initial, we gave the seed funding and then they've started it. So we fund, with the Governor's Commission, we fund several different seed programs across the state. And that was, I think, one thing we're very proud of what we've done. I'm hoping that as these folks graduate, we'll be able to attract and retain folks in our rural communities. Now, interestingly enough, Pahrump obviously is becoming such a kind of really a bedroom community of Las Vegas with the changes in the roads, and it's very easy to get in and out. So hopefully as we grow, we'll be able to attract more physicians to actually be in the community, stay in the community for a period of time. Now, having said that, as Chuck said, we do have a good Video Connect provider, Video Connect doctor from San Francisco, excellent high caliber doctor. So we do that. And we have a great PA in that location and a nurse practitioner, Kelly Lau and Bill Carl, both are excellent there. So we do have excellent clinical staff there. The other thing we are looking to add, and we're little by little looking at, is adding some specialty services toward Pahrump. So we've talked about, we're looking at perhaps adding a little bit of chiropractic care in Pahrump, which would really help our veterans so that they can get this care right in near where they live rather than have to go to a longer distance drive. And so little by little, we're hopefully beginning to add specialty care into Pahrump. That's our goal right now. I'll stop there.
Hey, Chuck, this is Bill. If I could add to that, it's not unlike we've proposed quite a few things that we're hoping will be grabbed upon. Back in the days when I was in the military, you had USHUs, they had their own medical school. You had different programs that would pay for that schooling, but then you were told where you were going to work. And we can't do that in VA. All we can do is recruit and try and retain. We can't force people's hands on working in a particular location for any significant period of time. So that's been a challenge, but we are trying to take some of those examples and models from DoD and apply that to VA. And as Dr. Komanduri mentioned, growing our own and creating those incentives where we help them out with school or whatnot and get some commitment in specific locations would be wonderful. So it's not a lack of funding or a lack of effort. We just don't have the applicants at this time.
All right, great. Thanks, Director Karen and Dr. Commodore. I appreciate that. A couple updates from Mr. Wagger that he put in a box there. One is he talked about he gave a number that I put in a box, which is 702-830-2000. That's how you can reach the veteran service officers that work with Nevada Department of Veteran Services. And then also he put it in a box here. I'm gonna highlight it. The Department of Veterans Services, actually the governor, they have different committees that are out there, and one is Women Veterans Advisory Committee. So they are looking for any women that are interested in being part of their advisory committee, and that is the link there that Mr. Wagger had provided for anybody who's interested in serving on that committee. I think it's also got a list of different committees in the state if you're interested in those as well. So thanks for providing that. Next question we had is there was a question asking about when our release of information office was opening. That's one of those things with business operations as we're returning to normal. We're going to work on that with leadership and we'll get some information out on that so everybody knows what's going on there with those offices. They do have, if you go to our website, lasvegas.va.gov, and you click on, there's an orange button at the top. It's kind of an alert. You go in there, it'll kind of show you the status of our various different services. And in there, we got to go through and do a couple of little minor updates, but on there, it'll show you how you can reach that service either via an email or a phone number to try and work your issue virtually. So we do have some options to reach those departments. It's just, it may be a little different than it was pre-COVID. The one other thing I did want to mention on the call today too is as we return to normal operations, we had for the longest time because of COVID, we had a no visitor policy in our inpatient wards in the hospital. We have lifted that. So veterans who are inpatients in the hospital can have one visitor at a time on site between 8 a.m. and 6 p.m. Daily. They have to screen through the main entrance, either the east or the west entrance, whichever one is open during that time. They're both open up normally, I think, during the week, but on weekends they kind of rotate that. So they have to process through that entrance, like we said, one visitor at a time. There's no visitors to the COVID wards except for extenuating circumstances or veterans in COVID rooms. Excuse me. We don't have we've kind of taken down the COVID ward, but we are allowing inpatient visitors again, and we are still allowing a family member 18 and over to escort a veteran to their appointment. So I did want to point that out as well. So that we can go from there. So those were kind of the big topics there. We had a couple other questions that came in today that are kind of more of a personal nature, and we're going to address those with those veterans one-on-one offline. So that is it for the gist of the questions we got today. And I do have an answer that came in while we were talking here. I'm going to see if I can read it. Excuse me, I'm trying to multitask here. So looking for it. Let's see. All righty. So there is for a person who needs that they're trying to get their medications paid for, is the Payment Operations Management Center. There's a phone number. I'll put it in the text box, but it's 1-877-881-7618, and they can walk anybody who's looking for medication reimbursement through the process. So I will share that in the box here for you. So to answer that question. All right, so those are the questions we had today. I don't see any new ones in my email box here. So Mr. Karen, sir, I'll turn it over to you for any closing comments.
Yeah, just some reflection. I mean, it's been a little over a year since the first COVID positive inpatient was identified, not just here at this VA healthcare system, but in the state of Nevada. We went through a remembrance ceremony and did some reflection here this past week. I will tell you, we've seen these waves and surges of COVID, similar to what you've seen in the community here. And the fear of the unknown, the flexibility, the adaptability of staff, everyone, all hands on deck, finding a way forward. I never once heard from any staff member a response of no, we can't. It was always, how do we find a way to yes in keeping our veterans safe, providing them the healthcare they need, and keeping our staff safe. I'll tell you, the emotions ran from heartbreak to euphoria, depending on if you're walking up in the COVID unit and we lose a veteran. That staff was completely torn up because of the challenges, the inability for family to interact, on a normal basis in those last hours. And then you walk downstairs to where we start doing vaccinations, and there's literally this air of optimism and gracious gratefulness throughout. So the realm of emotions has just been tremendous. I'd like to just keep in mind that we did lose 42, I think it was 42 or 43 veterans that came in here and were lost to COVID with the flag over that bed. And it was hard to see because these people worked so hard. And many more were saved and have done very well. And we lost 2 staff members as well. So this was a real challenging year, but I could not be more proud of the staff that's been providing the care for our veterans that we've done. I encourage you, your families, your friends, your fellow veterans, please get vaccinated. Look at the science. We're working our way out of this, and I'm grateful that our numbers have gone down and we're able to provide more and more care out there. But it's been a heck of a ride, but I couldn't be more proud of this group. We're in a unique situation here. We're growing. We're a healthcare system that's growing. We mentioned the many travel debacle that's going on. Part of that is because we're big. We're getting bigger all the time and we're growing. So we're leveraging VISN region support, national support, saying, hey, you got to help us out here. You rolled out this program. Let's work together and make it right for our veterans. We have opportunities here to really continue to do some great things and be the tip of the spear. So thanks all for your time and attention today.
All right. Thanks, Director Karen. I appreciate that. And then if you want to get any current information on what's going on here at our VA healthcare system, you can follow us on Facebook at Las Vegas VA or on Twitter at VA Las Vegas or Instagram at VA Las Vegas. And then our website, www.lasvegas.va.gov. That is where we post all of our current information as well. And there's a link on there where you can put your email address in. If you haven't, many of you probably did get an email from us because you have put your email in there before. We will alert you when we put a news story up or some information or some changes. So we want you to stay current on the information. We want you to hear it from us. So please take advantage of those communication resources. So this will conclude this quarter's town hall. We will schedule our next one probably sometime in the early summer. But in the meantime, if there's any assistance or questions you need, please feel free to reach out through our variety of resources that we have here at the VA, and we'll do all we can to assist you. And as we bring services and resources back online, we'll make sure we get that word out to you as well, either directly on our webpage or through our veteran service organizations, congressional staffers, and other community partners. So thank you so much for joining us today, and we look forward to continuing to serve you here now and in the future. So have a great day.
Hey, Chuck, I just wanted to say to Bill, great leadership. I have heard nothing but great things about what the VA has done during this whole pandemic, and especially now with the vaccinations. Bill, I hear just wonderful things. So congratulations. I know it's the entire staff, but it takes a good leader to make that happen. So great job.
We're all pulling together. Thank you.
All right. Well, thank you, everyone. Have a wonderful day, and thank you for your time, and we look forward to hearing from you again soon. Take care.